Well, the nation's largest drugstore chain is joining a growing list of companies making sweeping changes to employee health care programs in anticipation of the Obamacare rollout. Walgreens plans to send 120,000 workers to a private insurance exchange to buy their own coverage. The company says the switch will help cut rising costs. Similar insurance marketplaces are supposed to be up and running on October 1st, and a growing number of Americans are concerned about what's going to happen to their health care after that. The latest Fox News poll shows 43% of Americans are very concerned, 25% say they are somewhat concerned, and 17% say they have no worries at all. Richard Fowler is a radio talk show host and a Democratic strategist. Guy Benson is also a radio talk show host and a political editor at townhall.com. Gentlemen, thanks for being here.
Thanks for having me.
Allison. All right, let's debate what Walgreens is doing, because it's not all bad as far as at least what they're saying. They're saying that they will stop for more than 100,000 of their employees paying for their health care. But what they will do is give these employees payments to subsidize them buying private insurance on these exchanges. Richard, is that a bad thing?
No, I think this is a great thing for those individuals who work at the Walgreens Corporation, because what it says is it gives them choice. So if you're a young person like myself or like Guy, and you don't need, tons and tons of coverage, you could take the money that your company gives you and purchase a plan that fits your needs. Just as if you're an older individual, you can purchase a plan that fits their needs. And so I think it works. And I think this is the innovation that the president wanted to see when he passed his health care law to begin with. He wanted to see companies and individuals in the country sort of find innovations to make health care cheaper, more affordable, and work for the American people.
Okay, Guy, so more choice, more competition. Is it as good as Richard thinks?
Oh, I don't think so. It's not a surprise there. But I want to quote someone who I think is relevant in this discussion. This is President Barack Obama speaking in July of 2009, and I brought it along so I have the verbatim quote exactly correct. He said, quote, "If you like your health care plan, you'll be able to keep your health care plan, period. No one will take it away, no matter what." End quote. That was the president making his pitch to the American people about all the wonders that would occur under Obamacare. And now 120,000...
Wait a second, Guy. But nobody's taking away these Walgreens employees' health care. They're actually getting more choices and more options. And you could keep the current plan if you'd like.
Are we sure about that, Richard?
That's not true.
About that? Because, obviously that 2009 line has come back to haunt the president, because he said, if you like your doctor, you keep your doctor. If you like your plan, you keep your plan. And it has proven true for many employees as they approach October 1st that they're not going to be able to keep their plan. So, Richard, are you sure that these Walgreens employees are going to be able to keep their plan? Because it sounds like they're going to now have to cough up more money than they used to when it was all employer covered.
Well, I think we have to get more details on exactly what the Walgreens plan includes and how much subsidy the company is giving their employees to purchase health care. But with that being said, I think, and I think Guy could agree on this, having choice and competition seems to be the way to go here. I think that's what we saw when President Bush created the health care savings accounts, which gave individuals choices on how they spent their health care dollars pre-taxes. And I think this is the same thing. And I think this is a good thing for the American people, and it's a good thing for the employees of Walgreens.
Guy, talk about that, because Walgreens does say that it will give their employees more options and allow them to choose from more competition.
Oh, there's a few points to make in response to what we just heard. First of all, health savings accounts are dramatically reduced and given less favorable treatment under this law. So I'm glad that Richard brought them up, but Obamacare actually brings them down a couple pegs and makes them less generous and less helpful to average people. Secondly, it simply is not true that employees at Walgreens are going to have the same plan anymore. They are being dropped from their current coverage into this new plan. Look, hey, Richard, I didn't interrupt you.
Go ahead, Guy.
Yeah, I didn't interrupt you, so I'm just going to finish the point here. Walgreens is dumping their employees into new coverage. You can make the argument that it's more choice and competition. It's a good thing. But if people had their employer-based plan at Walgreens and liked it, they can no longer keep it. That is a violation of the promise that the president made. And here's the other point, and this is where yesterday's CBO report comes in. We saw that over the next 25 years, according to the Congressional Budget Office, their projections show that the health care costs in this country are going to nearly double in the next 25 years. So that cost curve that was supposed to be bent downward by Obamacare is still going up and up and up. And therefore, if employees are now responsible for paying for more of their health care because they're only getting some subsidy from their employees rather than the coverage itself, you're going to have more out-of-pocket costs for families and individuals.
Go ahead, Richard. How can that not be more out-of-pocket costs? It sounds like it will be.
Well, there's a couple of points that Guy makes that I want to sort of unpack for a second. So yes, the CBO did indicate that there will be an increase in healthcare costs, and that is because the Obamacare, the Affordable Care Act, was the first step in fixing America's healthcare problems. And I think if you were to ask a lot of Democrats and a lot of progressives on the Hill, they would have said a single-payer option would have been better. And I think Obamacare is the first step to fix our broken healthcare system. Not to mention the fact, and let's go back to Walgreens in particular. And yes, I will indeed admit that there's a possibility that you might not get the same coverage. But I think that we could all agree. Hold on, wait a second, Guy. I think we can all agree here that giving employees more choices is one of the best things. I remember when I got my first job and I had my first health care coverage, and I'm like, why am I paying this money for health care when I don't choose to use it? So I could get a smaller plan and pay less. And I think all Americans could agree with that.
And that,
Hang on, can I ask?
Let me just say one thing, because I do want to, before I go back to you guys, I just want to have Richard very quickly respond to, it does sound like the president overpromised in 2009 when he so definitively said, if you like your plan, you keep your plan. That is proving not to be true, Richard.
Well, I think we have to see what that looks like after the exchanges go into place. But I think if in the particular instance of Walgreens, there is a possibility that if you like your health care plan, you can purchase it on the market with a subsidy from your company to do so.
Okay, Guy, go ahead.
Okay, so I just have two questions for Richard. Since you're such a fan of choice and competition, I assume, correct me if I'm wrong, I assume that you're in favor of Paul Ryan and Ron Wyden's bipartisan Medicare reform, right? You have to be if you're in favor of choice and competition.
No. No.
I'm just
pointing out the hypocrisy in the conservative argument on this one.
No, and I'm pointing out your hypocrisy.
But they're not for choice when Obama does it, but they're for choice every other time.
I like that you're both doing my job and pointing out each other's hypocrisy. That's handy. I can sit back and outsource this.
Allison, if I could, yes. I'm just curious, Richard, you said that Obamacare is the next step in fixing the system.
The first step.
Because what we really need is a single-payer, government, fully run system. Is that an admission that Obamacare is unsustainable?
That is an admission that I think we have a broken healthcare system in this country and we have to fix it. And Obamacare, or the Affordable Care Act, is a step in the right direction.
Okay, this is what I get for having some radio guys on. They start asking the questions. Richard Fowler, Guy Benson, thanks so much for the debate. We shall see what happens October 1st. Thank you.